Well, all week we've been taking a look at why almost nothing has been getting done in D.C. in our special series, Broken Government. So a day after both parties sat down with President Obama to talk health care, are we really any closer to reform? Here to break it down for us, we have Kenneth Thorpe. He's a professor of health policy at Emory University. He also worked for the Health and Human Services Department for President Clinton and evaluating what the impact the former president's health care proposals would have had. Good to have you with us this morning, Kenneth. And also we have Dr. Bernadine Healy with us, the health editor of U.S. News and World Report, also the former director for the National Institutes of Health. Great to see you as well, Dr. Healy.
Good morning.
Kenneth, let me start with you. I mean, look, we had this year of back and forth, proposals on the table, something passing in the House, something passing in the Senate, and now the president basically moderating a big discussion and debate about health care. Do you think we're any closer to reform?
Well, I do. I thought yesterday was really monumental. I think we moved past the sound bites and really got into substance. And I think the American people could sort of see where both parties were coming from. And it kind of exposed, I think, two big issues. One is the extent to which we are going to regulate the insurance industry. There are big differences of opinion about how much regulation to have there. The Democratic proposals would go a little bit further in making sure that you can't deny people coverage if they have pre-existing conditions, for example. And the second big difference was how serious are we going to be on covering all Americans? The Democratic proposal as it stands would expand coverage to about 31 million Americans. That's going to cost some money. The Republican proposal would expand coverage to about 3 million Americans. So there's a big gulf there.
Yeah, there sure is. And, you know, one of the interesting things was this exchange, because people are still, you know, going back and forth about the facts and arguing their points of view. And I want you to listen, Dr. Healy, to this exchange between Lamar Alexander and President Obama on whether or not premiums would rise under President Obama's plan.
So, Lamar, when you mentioned earlier that you said premiums go up, that's just not the case according to the Congressional Budget Office.
Mr. President, if you're going to contradict me, I ought to have a chance to. The Congressional Budget Office report says that premiums will rise in the individual market as a result of the Senate bill.
No. Let me, and this is an example of where we've got to get our facts straight.
That's my point.
Well, exactly. So let me respond to what you just said, Lamar, because it's not factually accurate.
All right, so this was fact-checked, Dr. Healy, by a lot of folks who essentially called it a draw, saying that, you know, they were both cherry-picking information from the CBO report that premiums would go up a little bit, but it's more complicated than that. But doesn't this sort of just illustrate how difficult it is to really get a straight answer of how some of these changes would affect the cost and health care in the future?
Well, I think that's right. And in fact, I think you picked out the nugget, an important nugget, which is what's going to happen, America is asking, to my premiums and to my cost of medicine. And the real answer is it's going to go up. And finally, there was a concession. Yes, it will go up, but guess what? You're going to get a better policy. And that gets to the second issue, which is that people are going to be getting policies that are selected by the government, sometimes more than they need. The catastrophic policy was sort of dinged by the president. He believes everyone should have the same policy, the same comprehensive policy. Well, maybe that's not what the 30-year-old needs. Maybe they can get by very well with a primary care plus catastrophic. But one thing that came through loud and clear is that D.C. is going to say this is what everyone needs. And the trouble with that is it increases the cost. Premiums will go up, especially on young people, and that has to be discussed. It's the one thing I wish that had been discussed.
And, you know, Ken, the other interesting thing, and you just spoke to this as well, that the president's plan and Democrats say we need to cover 31 million uninsured Americans. I mean, there's 47 million uninsured Americans, they argue. And when you talk to Republicans, we talked to Senator John Cornyn yesterday, he said, no. I mean, that's a wildly inflated number, that when you talk about people that actually want and need insurance and can't afford it, you're talking about a much lower number. If you can't even necessarily agree on who wants and needs health insurance at various stages of their lives, how can you move forward on who is going to get it under a plan?
Well, I mean, again, going to the facts are really important, as we've just been talking about. According to the Census Bureau, about 40 million Americans on a typical day don't have health insurance coverage. So that's a fact. Secondly, on the cost of insurance, if you look at people buying coverage in the individual market by themselves, the CBO, Congressional Budget Office, has said that 18 million of them will have lower premiums. So that's right out of the CBO report. The remaining 14 million people who buy individual coverage will either pay the same or a little bit more, but they'll get better policies. And just really quickly in terms of
go ahead.
On this Washington issue. The states actually are much more prescriptive in terms of health insurance premiums and what's in a package than what's in the Senate and House bills. I mean, these Senate and House bills would provide tremendous flexibility in what would be in these packages. You could buy an insurance package where you would pay 40% of the cost, all the way up to a package where you pay only 10% of the cost out of pocket. So the packages are much less prescriptive in the House and Senate bill than they are under current state regulation in terms of state mandates on what has to be in an insurance benefit.
All right. Well, we're going to have to leave it there. Kenneth Thorpe and Dr. Bernadine Healy, I thank both of you for being with us this morning. 37 minutes past the hour.
Thank you.